Hello guys, how is your NCLEX review going? Today we will be talking about one of the most common diseases that you might encounter in your NCLEX exam, which is that of hepatitis. And hepatitis is basically inflammation of the liver tissue. It's plain as simple as that. And believe it or not, a good portion of the people who has the less severe type of hepatitis will sometimes show no symptoms at all, whereas others can develop some of the more common symptoms such as jaundice, which is basically yellow discoloration of the skin. And what occurs is that the liver is not able to break down basically or get rid of the bilirubin, which is a yellow pigment that is formed when our bodies break down the red blood cells in the body. Okay, in the liver actually. Now, other common symptoms includes poor appetite, vomiting, tiredness, lethargy basically, abdominal pain, and diarrhea. Now, as we all know, hepatitis can be temporary, or what we call acute, or it can be long term, which is chronic, depending on whether it lasts for less than or more than 6 months. Okay, now acute hepatitis can sometimes resolve on its own, or it can progress to a chronic hepatitis. But the thing is, if it's not treated, it can eventually lead to acute liver failure. And what happens over time is that chronic form can progress to a scarring of the liver, right? Or can even cause, like I said, liver failure or liver cancer too. Now, let's talk about classifications of hepatitis and the way of transmission. Now, there are actually 5 types of hepatitis. There's A, B, C, D, and E. And this is a quick review, so we're just going to go over basically the first three hepatitis, which is A, B, and C. Now, let's start with hepatitis A. The incubation period usually can last from 15 to 45 days, and it can be transmitted primarily through fecal and oral route. So, prevention basically includes sanitation and hand washing, okay? And there is a vaccine available for hepatitis A. Now, with hepatitis B, it's transmitted through blood to blood contact, also sexual contact, and drug use. So, being in contact with needles and razors. Now, there is also a vaccine that is available for hepatitis B. Okay, now lastly, we will look at the most serious one actually, which is hepatitis C. And hepatitis C is transmitted again through blood to blood contact and also sexual contact and drug use. Now, take note that the patient can be asymptomatic with a person with hepatitis C, and some are only diagnosed once abnormality is being detected within the liver enzymes. Now, symptoms of acute hepatitis C includes fever, fatigue, loss of appetite, nausea and vomiting, abdominal pain, and jaundice, okay, which is the yellow discoloration. Now, here are a few of the things that you want to keep in mind for your NCLEX exam. Now, with hepatitis B and hepatitis C, it is connected with cirrhosis and liver cancer, okay? Now, also, what we call enzyme-linked immunosorbent assay, or what we call ELISA test, is the initial screening test for these clients suspected of being infected with hepatitis C, HCV virus. Now, liver biopsy can also be used to confirm the diagnosis of hepatitis, okay? And the treatment most often used for a patient with hepatitis C is a combination of two medicines, interferon and ribavirin, okay? Again, this is a quick and short review, so this is it for now. Good luck on your NCLEX exam, and thank you so much. God bless. Thank you. Hey guys, how's everyone today? How's your NCLEX review going? Now, plenty of people that have failed their NCLEX exam mentioned to me about stumbling upon a disease that they thought they knew about, yet they actually do not have enough knowledge and information about it to really nail the correct answer. Now, I think sometimes when you take your NCLEX exam, you'll encounter some diseases that you thought you knew and have already learned, but not really like fully covered to the extent that you eventually positively know the answer. And it seems that sometimes we tend to take some information for granted. Therefore, we lack the info to have like a really good, informed, educated guess, right? So today we'll be talking about one of those diseases that you might and will encounter in your NCLEX exam, and that is glaucoma. Okay, so now let's talk briefly about glaucoma. Glaucoma is a disease that damages your eye's optic nerve. Usually happens when there's a fluid buildup, and that extra fluid increases the pressure in your eye, eventually damaging the optic nerve. Now, in a healthy eye, excess fluid leaves the eye through the drainage angle, which keeps the pressure stable all throughout. Okay. Now, there are two types of glaucoma. There's the primary open angle glaucoma and angle closure glaucoma. And it's also called a closed angle glaucoma. Okay. Now, let's go over primary open angle glaucoma. Now, primary open angle glaucoma is the most common type of glaucoma. It happens gradually where the eye does not drain fluid as well as it should. And as a result, eye pressure builds and starts to damage the optic nerve. But this type of glaucoma is painless and causes no vision changes at first, okay? On the other hand, angle closure glaucoma, or what we call closed angle glaucoma, happens when someone's iris is very close to the drainage angle in the eye, and the iris can almost end up blocking the drainage angle, okay? Now, you can think of it like a piece of paper over a sink drain, right? When the drainage angle gets completely blocked, eye pressure rises very quickly, and this is called an acute attack. Okay, now this information is very, very important because it's a true emergency, and you should call the ophthalmologist right away, or the person can go blind. Okay, so those information is very, very important to know about. Now, let's go ahead and look at our NCLEX review question. Okay, so the question is, which statement about glaucoma is true and accurate? Okay, number one, acute angle closure glaucoma is an ocular emergency. Number two, acute angle closure glaucoma leads to the loss of peripheral vision and tunnel vision. Number three, primary open angle glaucoma leads to eye pain, nausea and vomiting, blurred vision, and halos. And number four, bubbles are implanted to protect the retina from glaucoma. Okay, so now, if you were listening carefully to my quick previous lecture about glaucoma, you will realize that the correct statement is number one, right? Acute angle closure glaucoma is an ocular emergency, and it is usually characterized with eye pain, nausea and vomiting, and blurred vision and halos, which would make number three a false statement, right? And if you look at number two, it is also a false statement, since the signs and symptoms of primary open angle glaucoma and not acute angle glaucoma are the loss of peripheral vision and tunnel vision. Okay, now number four is false because bubbles are placed to treat retinal detachment, right, and not from glaucoma itself. Okay, now I'm just gonna keep it short and sweet, guys. Again, thank you so much for stopping by. I wish you the best in your NCLEX review. I know you guys will do great. Please don't forget to visit my website to get plenty more notes at www.allnursingnotes.com. Again, have a blessed day, guys. Thank you so much, and God bless. Thank you. Hello, guys. How is everyone doing? I have read plenty of requests about people asking me about being very anxious and scared and having to start their NCLEX review because it seems that there's just too many things to retain and remember, so many normal and abnormal values and measurements to remember. And so many of you guys start to have what we call analysis paralysis, right? Which is basically just anxiety of having to start. Don't know where to start. Well, it is a fact that you do have to know all these things, right? Just like a licensed CPA or a lawyer or even a doctor. Not to say that these jobs are all equal in their level of difficulties, but each one, as a licensed professional, do need to show a level of knowledge, right, in order to show competency. And also understand that as a nurse, you do have to you have the patient's lives in your hands, right? So with that in mind, I think first you need to be confident and know that hundreds and thousands or even millions of people have taken this NCLEX exam in the past and have passed it, right? So therefore, it's possible. Also, second, anxiety has a negative effect in your ability to be in a flow state, right? And have your ability to retain information. So get rid of anxiety and you gotta trust the process and just do the work, okay? On that note, let's begin this review. Now, for today's review, we will be looking at an NCLEX cardiovascular related review question, which looks at the basic assessment of a patient with PVC, okay? So, the question is, we are having a client who is having a frequent premature ventricular contractions. The nurse, you as a nurse should place priority on assessment of which item? 1. Sensation of palpitations. Number 2. Causative factors such as caffeine. 3. Precipitating factors such as an infection. Or 4. blood pressure and oxygen saturation. Okay guys, so we have a patient who is having premature ventricular contractions, right? PVC, which is basically an extra abnormal heartbeat that begin in one of your heart's two lower chambers or ventricles, okay? Now these extra beats disrupt your regular heart rhythm, which causes what we call a skipped heartbeat, right, in your chest. Now, understand that premature ventricular contractions are very common and they can actually occur in most people. So basically, if you do have an occasional premature ventricular contraction, but you're a healthy person, there's generally no reason for concern and no treatment is needed. But if you do have frequent premature ventricular contractions and you do have an underlying heart disease or a diagnosis, right, you may need treatment, okay? So premature ventricular contractions, it causes what we call hemodynamic compromise, which basically your hemodynamic or blood movement is compromised. Therefore, the priority is to monitor the blood pressure and oxygen saturation. So the answer here would be number 4, which is blood pressure and oxygen saturation, because since if we look at our ABCs, right, our airway, breathing, and circulation, our breathing and oxygenation is the number 1 priority, right? So also understand that the shortened ventricular filling time in a patient with PVC can also lead to a decrease in cardiac output. So we do have to be aware of that. Now the other answers are number 1, 2, and 3 are actually a causation or a causative, what we call physiological stressors, right? It's actually physiological stressors that can cause a premature ventricular contraction, such as a patient having an infection or an illness or a surgery or even an intake of caffeine or alcohol, okay? So guys, I'm just going to keep this short and sweet. I know you guys are busy. Again, thank you. Thank you for visiting. I wish you guys a blessed and a wonderful day. Study hard. And don't forget to visit my website at www.allnursingnotes.com. Again, I wish you guys the best. Thank you. Thank you so much. Again, thank you so much and God bless. Have a great day. Hello everyone, how is your NCLEX review going? I hope everyone is doing great. I hope you're retaining all your NCLEX information smoothly without any plenty of anxiety. Now in this video, I want to talk about how sometimes when you will be taking your NCLEX, it can seem that some of the questions that might seem very simple, yet we still make a few silly mistakes here and there. You know, things can be simple, yet we can still make a logical mistake, right? So let's go over this question, which we all think it's a simple question, but the fact that it's a select all that apply question can sometimes make it a little tricky. Okay, so here's our question. The registered nurse or RN in a medical surgical unit is working with a licensed practical nurse or an LPN and also an unlicensed assistant personnel or a UAP. Now, which tasks are most appropriate to assign to the LPN, right, to the licensed practical nurse? Select all that apply. Okay, so it's a select all that apply question. 1. Administering a scheduled analgesic to a client with chronic back pain currently rated 8 out of 10. Number 2. Assessing fluid volume status of a client with heart failure who is scheduled for discharge. Number 3. Assisting with bathing, feeding, and dressing a client with multiple sclerosis. Number 4. Performing wound care and sterile dressing change for a client with a stasis ulcer. And number 5. Providing incontinence care and linen change for a client with diarrhea. Okay guys, now the first time you might see this question, it might seem like it's a straightforward, knowledge-based, easy question to have, right? But the tricky part here is that it's a select all that apply question, which means one simple error will make this entire NCLEX question a mistake, right? So first we have to look at each of the options or answers individually, one by one, and analyze if it does reflect the major question that it's asking, which is the task that is most appropriate to assign to an LPN person, okay? Now, let's look at option number 1. Now, understand that pain rated at 8 out of 10 is usually an unexpected finding in a client with chronic back pain, so don't get fooled by the level of pain. It could be a 9 out of 10 or a 10 out of 10, okay? And also obviously oral analgesic can be administered as scheduled by the LPN, and the key word here, guys, is scheduled, okay? Although the client would have to be assessed by the RN, but since it's asking for a test that is appropriate to an LPN, yes, the LPN would be able to administer a scheduled or an analgesic. Okay, now let's look at, so one is definitely okay. Number two, the LPN may perform specific assessments, but evaluating the fluid volume status of a client with heart failure, it's kind of like a comprehensive assessment, right? And it involves multiple body parts, the hearts, the lungs, maybe some peripheral edema, yeah, urine output, right? So this also, the fact that this client would also need to have a discharge education on home management due to the heart failure. This should be this is an appropriate delegation for to the RN. This is a responsibility to a registered nurse. Okay, so number two is not very appropriate to assign to an LPN. Now let's look at options 3 and 5, which is assisting with bathing, feeding, and dressing the client with multiple sclerosis, and number 5, which is providing incontinence care and linen change for a client with diarrhea. The problem here with this, guys, is that although these tasks can be safely carried out by the LPN, it's gonna underutilize the use of the LPN, right? Therefore, this task should be delegated to the unlicensed personnel, or the UAP. Okay, so because it's just an ineffective use of resources. Okay, so 3 and 5 should not is not appropriate to assign to an LPN. Now let's look at 4, because we kind of skipped 4. Now, wound care and routine medication administration are the most appropriate tasks assigned to the LPN, because our LPN does perform sterile procedures, and they do clean and dress the wounds. Therefore, this is a definite appropriate assignment to an LPN. Okay, so the answer for this question would be number 1, right, and number 4. Okay, so the lesson here, guys, is that we can never be complacent at all, especially if it seems like it's a very basic, easy question, right? Because with select all that apply questions, one mistake is all that it takes to make the entire question completely wrong, right? So we always have to be vigilant and make sure to always double check and always analyze every single possible option, okay? Now, this is it for now, guys. I'm just going to keep it short and sweet. Thank you so much for sticking around. I wish you the best in your NCLEX review. I hope your NCLEX review is going well. I hope you have a blessed and a productive day. And if you do get a chance, please visit the NCLEX review website, which is at allnursingnotes.com. Again, that's it, guys. Again, thank you so much. God bless. Thank you.